Hello, you are most welcome, ladies and gentlemen, to Real Impartation Moment on Tuesday Night Anatomy with Daniel Okwan. Today's section, I want to take you through muscles of mastication. And these muscles of mastication, yes, they are actually four. And with the mnemonic time, yes, you'll be able to know them. Yes, you'll get to know that, yes, of course, T in the time represent what we call the temporaris muscle. I for, of course, internal pterygoid or actually medial pterygoid. M for master muscle, and of course E for external pterygoid or lateral pterygoid muscle. Now remember that these muscles are going to produce various movements of the mandible to aid in chewing, because of course the mandible is the main bone for chewing, but of course causing that kind of movement at the temporomandibular joint. Now these muscles developmentally will be coming from, of course, the first pharyngeal arch or the first bronchial arch, and therefore their nerve supply will be coming from nerve to the first bronchial arch. And that nerve is, of course, the mandibular nerve. The third division of what we call the trigeminal nerve, mandibular nerve. But one thing that we find is that, yes, out of these four muscles, you get to know that it's only the medial pterygoid or the internal pterygoid muscle which will actually be supplied. Okay, out of these, masticatory muscles, it's only the medial pterygoid muscle which will be supplied by the main trunk of the mandibular nerve. The remaining ones, like the temporaris muscle, master muscle, and of course lateral pterygoid muscles, yes, they will actually be getting supply from actually the anterior division of the mandibular nerve, eventually giving that kind of nerve supply to them. And so, without much ado, let's set the ball rolling. So because, these muscles are going to cause movement of the mandible at the temporomandibular joint to aid in chewing, then it's very important that, we look at what we call the temporomandibular joint, the TMJ joint. So the temporomandibular joint, what we find is that we have what we call the condyle, okay, coming from the ramus of the mandible. Yes, its head actually fitting into what we call the mandibular fossa, okay, in what we call the temporal bone. At the inferior aspect of the temporal bone, we have this mandibular fossa, so that the head of the condyle of the ramus of the mandible actually fits here to form this temporomandibular joint. Get to know that this temporomandibular joint is what we call a synovial joint. Actually, it's a condyloid type of synovial joint. Therefore, if it's a synovial joint, then of course, by way of enforcing, giving support to the joint, will be a joint capsule. A fibrous joint capsule, which of course, at the external aspect, it will be, inner aspect, it will be lined by what you call synovial membrane. And this synovial membrane will be very important in secreting what we call synovial fluid to lubricate this kind of joint, so that it reduces friction as far as the movement over there is concerned. Not only is it going to reduce friction, of course, shock absorption, giving that kind of nourishment to the region around this area, very important. Also taking away waste will be by what we call the, synovial fluid that will be over here. Now, one other thing too that we find is that apart from the fibrous joint capsule giving that kind of support over here, the support, yes, is also getting some kind of reinforcement from some ligaments, which we call them lateral ligament of the temporomandibular joint. So the lateral ligament of the temporomandibular joint is also reinforcing this kind of joint capsule. Okay, but one thing that we find is that there are two other ligaments that we find, okay, which are actually modifications of what we call the investing layer of the deep cervical fascia. I will take you through the deep cervical fascia in our subsequent videos. We look at that. And those kind of investing layer, yes, will give rise to these two other ligaments that we find. These other ligaments are therefore known as false ligaments of the temporomandibular joint, because yes, although they are coming from the investing layer of deep cervical fascia, therefore making them false, they are not directly reinforcing this kind of joint capsule or the temporomandibular joint actually. And these ligaments are, yes, one over here, taking attachment from, of course, what we call the styloid process of the mandible, okay, styloid process of the temporal bone, and of course inserting around the angle of the mandible. This ligament therefore is what we call stylomandibular ligament. Now this stylomandibular ligament is also very important in separating what we call the parotid gland, okay, superficially, from, of course, the submandibular gland. So that one is what we call the stylomandibular ligament. Apart from that, the other ligament we see over here, which is also, attaching from what we call the the spine. Okay, actually the spine of what we call the sphenoid bone. Now remember that the spine of the sphenoid bone is the most posterior aspect of the sphenoid bone. So inferiorly, once you can identify the spine, that is where this sphenomandibular ligament will be, taking attachment from, and of course will be inserting or be attaching into the inner aspect of the ramus of the mandible. So this ligament is therefore known as sphenomandibular ligament. Sphenomandibular ligament. So these ligaments are actually not reinforcing directly, this temporomandibular joint, but yes, they are coming from actual modifications of the investing layer of the deep cervical fascia, and therefore we call them false ligaments of the TMJ. So please get to know that. So having seen, of course, this kind of joint, then we want to begin with our thigh muscles. And one of those thigh muscles, yes, is what we call the master muscle. Now, this master muscle, yes, I would say that that is the, external, quite most externally placed, muscle over there. And this muscle, yes, now get to know that most of these, muscles will be originating from a higher origin. Okay, so proximally they will have a proximal origin, then they will be inserting in a distal origin, and therefore by way of action most of them will be elevators of the mandible. They will help in elevation, and as you cause elevation, then that is what we mean by trying to close your mouth. Okay, so this master muscle is actually having two heads. So it's going to have what you call a superficial head, and of course it will also have a deep head. Okay, that superficial head is also known as the outer head of what we call the master muscle, and that one is actually coming from what we call the temporal process of the zygomatic bone. So yes, you know that this over here is known as the zygomatic arch, but we're actually looking at the temporal process of the zygomatic bone. That is where it's going to originate from, the superficial head, while the deep head will be coming more from what we call the zygomatic process of the temporal bone. But at the end of the day, both of them, yes, moving, somewhat posterior inferiorly. So they orient posterior inferiorly to insert on what we call the ramus of the mandible together with the angle of what we call the, mandible. So by way of where, this muscle is actually going to insert, then upon contraction, it will cause, that kind of upward. It will be pulling the insertion point. So mainly, it will be very important in what we call elevation of the mandible, so that you can actually clench your teeth, bring your teeth together, clenching your teeth. Okay, so this is, the master muscle. So in the presence of other muscles, yes, we're saying that it's very external as far as, the muscle over there in the mandibular region, more or less quadrangular shaped. Okay, and then we're saying that yes, it's going more or less, posterior inferiorly. Okay, posterior inferiorly in that manner. Having two fibers, we are saying we are going to have a superficial fibers. Okay, the superficial fibers will actually be coming from what we call the temporal process of the zygomatic bone, while the deep fibers will be coming from, of course, this process being, of course, the zygomatic process of the temporal bone. But both of them, going to insert in what we call the ramus and, of course, the angle of the mandible. That is why upon contraction, it will be moving, the insertion point. Very important as far as elevation of the mandible. Moving the mandible against gravity. Now, the next muscle, okay, which is fan shaped, or let me say roughly triangular shaped. Okay, this muscle is actually taking origin now on what we call the parietal bone. We have two lines over there. We have what we call inferior temporal line, and of course superior temporal line. I'm interested in the inferior temporal line because the inferior temporal line will provide that kind of origin for this muscle. Okay, and this muscle mainly will fill what we call the infratemporal fossa. Okay, I will take you through the anatomy of infratemporal fossa in a later section, but it's going to be filling most of this area, actually the lower aspects. Okay, will be filling the most area of the infratemporal fossa. So taking origin from what we call the inferior, okay, temporal line will be by this muscle, which we are calling it what we call the temporalis muscle. Okay, and then all the way it is going to actually insert on what we call the coronoid process on the ramus of the mandible, okay, coronal process of what we call the mandible, ramus of the mandible. Okay, so that is what we call the temporaris muscle. I've already told you that all these muscles, yes, with the exception of the medial pterygoid, they will be supplied by mainly coming from what we call the anterior division of the mandibular nerve. Anterior division of the mandibular nerve, mainly that is where they are going to, be the, the nerve supply. Okay, actually the deep temporal branches coming from, of course, the anterior division of the mandibular nerve. So that is that muscle. Now look at how the fibers are running, more or less running, so we have some fibers which are rent more anterior, some fibers going more posteriorly. And that is why because the muscle is actually having a proximal origin coming to insert distally, upon contraction it will be pulling it upwards. So it will be very important as far as elevation of the mandible will be concerned. But the posterior fibers, look at how the posterior fibers are oriented. The posterior fibers will be very important as far as retraction. Okay, bringing the mandible posteriorly. Okay, bringing the mandible posterior, retraction of the mandible will be concerned. So please get to know that that is what we call the, temporaris muscle. Temporaris muscle. Now, having seen the temporaris muscle, now the temporaris muscle in the living is covered by a fascia, and that fascia is called temporal fascia. And that temporal fascia, instead of originating from, of course, we know the muscle will be originating from inferior temporal line, the superior temporal line will be the origin for this temporal fascia, which will, of course, come in and, of course, insert on the superior aspect of what we call the zygomatic arch. Okay, zygomatic arch. So that is, so if I cut this temporal fascia, then deep to it, I'm going to have this temporaris muscle. So please, that is what I want you to know over here. Now the next muscle which we want to talk about, okay, which will be also very important, okay, as far as elevation is concerned. But one interesting thing about this muscle is that this muscle is, innervated by what we call the main trunk of what we call the mandibular nerve. Okay, main trunk of the mandibular nerve. Although this main trunk may also supply what we call, tensor belli palatini, or of course tensor tympani. What we are saying is that as far as muscles of mastication is concerned, it is only the medial pterygoid muscle which will be supplied by the main trunk of what we call the mandibular nerve. Now this, muscle is having two hairs, and for that matter, two origins. Okay, so one of its hairs being, of course, the superficial head. So let's look at the superficial head. The superficial head is actually coming from what we call, the maxillary tuberosity. Maxillary tuberosity. But not only that, it may also be originating from, some fibers may be coming from what we call the pyramidal process of what we call the palatine bone. We know that at the rear aspect of the lower aspect of what we call the skull, okay, superior aspect where we have the maxilla, yeah, from the maxilla, from the palate, the palate is formed by, of course, the maxilla and, of course, the palatine, bone. So it means that, yes, not only are we coming from what we call, is it going to originate from, of course, the tuberosity of the maxilla, but to also be coming, from that kind of process we call the pyramidal process of the palatine bone. Okay, then we're also saying that, the deep head is coming from actually the pterygoid plate. But this time we're going to come from what we call the medial pterygoid plate. Okay, it's going to come from the lateral pterygoid plate, but actually the medial surface of the lateral pterygoid plate. Now remember that the medial pterygoid plate has no, attachment surface, okay, or doesn't provide any surface for attachment to any of these masticatory muscles. So although we are calling medial pterygoid, it doesn't mean that it's originating from the medial pterygoid plate. A deep head is rather coming from the medial surface of the lateral pterygoid plate. Okay, so as I said, it's supplied by the main trunk of what we call the mandibular nerve. So this muscle, because of, look at how the fibers are orienting, then of course upon contraction, yes, bilaterally, it will help in, of course, elevation. So this is how the fibers are running. But at the end of the day, they are going to actually insert, okay, on the inner aspect of what we call the angle and, of course, ramus of the mandible. So upon contraction, now we saw that master muscle actually inserted on the external aspect of the angle and ramus of the mandible. While this medial pterygoid, yes, it's oriented just like that of master muscle, but that one will be inserting on the inner aspect or the medial aspect of what you call the ramus and, of course, angle of the mandible. And that is why, look at how the fibers were running. The fibers actually, run actually, posteriorly. okay, inferior-posteriorly or posterior-inferiorly in that manner. And that is why upon contraction, it will help in what we call, elevation of the mandible, just like, the anterior fibers of what we call the temporalis muscle, and of course, the master muscle. But apart from that, you see, this muscle also help in some kind of, protraction, bringing, this mandible actually anteriorly. So more or less like upon contraction, it will help, bring the, protrude, bring the, mandible actually, a bit anteriorly. So protraction of the mandible will also be done by this muscle. But contracting unilaterally, but it will be working in synergy with another muscle which you'll be seeing, that will be the lateral pterygoid, will help in what we call the side-to-side movement of the mandible to aid in chewing. Okay, when you are chewing, side-to-side movement of the mandible is, can you see? Yes, that's coming from what we call the medial pterygoid. Even apart from that, the lateral pterygoid muscle. Okay, so that is that, muscle that is having a superficial head. The superficial head is coming from what we call maxillary tuberosity, as well as, of course, the pyramidal process of the palatine bone. Then a deep head is coming from, of course, the medial surface of the lateral pterygoid plate. There is no place for what we call the medial pterygoid plate of what we call the pterygoid process. So please get to know that. Then the last muscle on this list, yes, is what we call the lateral pterygoid. Now remember, it is only the lateral pterygoid which is not causing elevation, because look at how the fibers are running. But this one, instead of having, yes, superficial and deep heads, it's rather having a superior head or an upper head, and of course an inferior or lower head. So the upper head of what we call the lateral pterygoid muscle will be coming from what we call the temporal surface. Okay, so there's the temporal area. So the infratemporal surface, okay, of what we call the lateral pterygoid. Of what we call the greater ring of sphenoid. Now this is the greater ring of sphenoid. Okay, that's the one we can appreciate over here, and the pterion will be related over here. This is what we call the greater ring of sphenoid. Okay, actually what we call the infratemporal surface of greater ring of sphenoid. Okay, and then the lower head or the inferior head will actually be coming from, this time around, the pterygoid plate, but this time around the lateral surface of what we call the lateral pterygoid plate. But look at how both of these fibers, these hairs, are joining to insert actually around this area, which we call it the pterygoid fovea, on the neck of what we call the condyle of what we call the ramus of the mandible. Okay, so this is that we have the ramus of the mandible. Okay, but we are looking at the posterior aspect, the posterior process where is coming from that area. That's the condyle, not the head, but actually the neck. Okay, the neck area, where there's a fossa, there's a fovea, there's a pit over there, and that's what these fibers are going to insert. Okay, and some of the upper fibers coming from what we call the upper head will actually be inserting around where we have the joint capsule. Okay, we'll be inserting around the joint capsule. So looking at this muscle, then upon contraction, okay, it will be very important as far as protraction of the mandible is concerned. Just like what I said, that the medial pterygoid may also assist in that kind of protraction, but mainly it is coming from, of course, the lateral pterygoid muscle. Okay, but I said that working unilaterally, okay, this muscle will be very important in producing what we call the side-to-side movement of what we call the mandible. So that is the lateral pterygoid muscle, the only muscle which is not going to cause elevation of the mandible, but it works synergistically with, of course, the medial pterygoid to produce the side-to-side movement unilaterally upon contracting unilaterally. Apart from that, it will also help in that kind of protraction of the mandible. So what have we seen? Now, if you take a look at it from the posterior aspect, then what do you see? What we said was that at the lateral aspects, okay, where the muscle is going to insert on the ramus of the mandible as well as the angle, we will have what we call the master muscle. But the inner aspect, we will see what we call the medial pterygoid muscle. Then above the medial pterygoid muscle, we see the lateral pterygoid muscle. Actually going to insert in the fovea, pterygoid fovea, okay, around the neck of what we call the condyle of the ramus of the mandible. Okay, so that is what we are going to see. So I mean, as far as the movement of the mandible are concerned, yes, if you bring the mandible, okay, push it such that it goes, I mean, anteriorly, okay, then that is what we call protrusion or protraction of the mandible. And this protrusion, yes, we've seen that mainly is done by the lateral pterygoid muscle, with some assistance coming from, of course, the medial pterygoid muscle. Now the opposite aspects, okay, bringing it posteriorly, that's what we call the retraction. Okay, so retraction of the mandible at the temporomandibular joint is mainly by the posterior fibers of what we call the temporalis muscle. Yes, we see some other muscles later, the suprahyoid muscles. Yes, those kind of, muscles which will be very important in the neck. Triangles, we will see that. Then, apart from that, we also have what you call elevation of the mandible. I've told you that elevation of the mandible, all these muscles of mastication are going to take part except the lateral pterygoid muscle. Yes, so the temporalis muscle, yes, anterior fibers, master muscle, and of course medial pterygoid will all be very important in elevation of the mandible to close the mouth. But in opening the mouth, that is what we call depression. Okay, depression of the mandible, yes, is mainly by what we call the lateral pterygoid muscle. Lateral pterygoid muscle. But apart from that, gravity also helps in that. As well as some muscles, we call them, the suprahyoid muscle, and of course the strap muscle being the infrahyoid, muscles. Then I've told you that in chewing, there's that kind of side-to-side movement at the temporomandibular joint to aid in chewing, and that one is by both, medial and lateral pterygoid muscles. So we've seen that, yes, these muscles, yes, all of them will be supplied by, of course, the mandibular nerve, okay? But one key thing is that it is only the medial pterygoid which is supplied by main trunk of the mandibular nerve. But the remaining ones will mainly getting their supply from what we call the anterior, division of what we call the, mandibular nerve, actually. So I'm very grateful for your time this evening. I'm very grateful for your time this evening. Have a good night, and may God richly bless you.